Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, Darren Rizzi, our Fire Chief and Director of Emergency Management, Sam Rogers, our Director of Enforcement, and this week we have a very special guest, Dr. Andrew Buzari, the Executive Director of Social Medicine at the University Health Network. As a doctor of social medicine, Dr. Buzari has long been advocating for a fair and equitable vaccine rollout. So I've asked him here today to talk about what he thinks has been working during this rollout and how we can ensure that the rollout continues to remain equitable in the coming weeks and months. I first want to talk about a very exciting investment that the federal government has made yesterday in a Mississauga-based company called Resilience, Inc. The $200 million investment will help the company manufacture hundreds of millions of doses of the mRNA vaccines by 2024, like the ones being used right here, right now, to vaccinate people against COVID-19. The reality is that investing in vaccine manufacturing is more important now than ever. And I want to thank the federal government for choosing a Mississauga-based facility. It's a testament to our incredibly strong life sciences sector and strong business climate right here in Mississauga. I'd also like to say a few words about a rally that happened last night in and around Celebration Square. I'll be very frank. I'm extremely concerned that a mass gathering took place during a stay-home lockdown order. And I'm angry that some people disregarded the rules around social and physical distancing and masking. But I am thankful that the rally was peaceful versus what we have witnessed in other jurisdictions. And I would like to thank Peel Regional Police and, of course, our city's own Mississauga Security Services for working hard last night to maintain the peace. Canadians do have a fundamental right to assemble, rally, and to protest peacefully. But I want to remind everyone that we're still in a stay-home order and people should be following the provincial rules that are in place, which are aimed at keeping our community safe. Like a lot of you, I've been following the Israeli-Palestinian conflict closely over the past few weeks, and it is a truly tragic situation. The politics and the history of the region are incredibly complex and divisive. And I know we will continue to see a lot of debate on the policies and actions of both sides in this conflict. But what's not up for debate is how tragic the loss of civilian life is, particularly the young children. As a parent, I have been truly gutted by the images of young children being carried away from the scene after an explosion. Entire families are dying together. And my thoughts are with everyone in Mississauga who's being impacted by the conflict, particularly those with family or friends in the region. The loss of life has been overwhelming, and it's as tragic as it is senseless. Peace must be the top priority. And I echo the calls of our Prime Minister and many others who are asking for a ceasefire. The international community must treat this with the seriousness it deserves and work to find peace. Otherwise, no one wins in this conflict. On the COVID-19 front here in Mississauga and in Peel, things continue to improve significantly, both in terms of our case counts and our vaccine rollout. Over the weekend, we saw close to 5,000 people receive the vaccine at our Doses After Dark clinic event, the 32-hour marathon clinic that ran nonstop between Saturday at 12:30 p.m. and Sunday afternoon. I stopped by the International Centre on Sunday, and I was amazed at how well it was run. And I want to thank Dr. Lowe and his entire team at Peel Public Health and all the volunteers who worked so hard over the weekend to get shots in arms. And I want to thank everyone who took the time out of their weekend to go and get vaccinated. You could just sense the enthusiasm and the hopefulness of all the individuals who were there. Dr. Lowe even gathered his teammates, Dr. Isaac Bogosh and Dr. Abu Sharkawi, our local resident celebrity doctor as well, who were out vaccinating with him on Saturday night. So thank you and congratulations. The truth is we should be hopeful. Our case counts are continuing to drop, and the situation at our hospitals continues to improve. Peel Region is now averaging 232 cases per 100,000, and that's down from 297 a week ago. Mississauga is averaging 171 cases per 100,000, and that's down from 242 a week ago. And what's really good news is that the R factor, which tells you how many people a COVID-positive individual will infect in our community, is well below 1. Peel Region's R number is now 0.82, and Mississauga's is at 0.76. What this suggests is that the threat of exponential growth is starting to subside. The situation at our hospitals is also becoming more stable. In Mississauga, Trillium Health Partners is dealing with 98 COVID patients, 20 patients in the ICU, and another 43 suspected COVID cases. The situation is similar at William Osler in Brampton, with 75 COVID hospitalizations, 13 patients in the ICU, and 43 suspected cases. On the vaccine front, I have very good news. We have now administered the vaccine to over 60% of all eligible adults 18 plus. That's very good news, and that's more than 835,000 people in Peel Region who have now received their first dose. Yesterday, we opened the vaccine to 16 and 17-year-olds living, working, or attending school in Peel Region. And starting tomorrow, everyone 12 years of age and older will be able to book an appointment. This is a big step forward for us and will play a critical role in helping ensure students can safely return to in-class learning soon. Mississauga, we have come such a long way, and I want to thank everyone for going out and getting vaccinated. We're also moving forward with several new initiatives to get even more people vaccinated. This week, we held a pop-up clinic for My Way and City of Mississauga employees at our Central Parkway Transit Campus. There's also a pop-up clinic in Malton at the Malton Masjid that runs until Saturday. Anyone 16 years of age in the L4T postal code can book an appointment by going to schedule theirs at schedule.dynacare. That's Dynacare, spelled D-Y-N-A-C-A-R-E.ca. Or you can book by calling 905-499-2969 and choose extension 2 to book your appointment over the phone. Ellis Dawn Construction launched their clinic this afternoon to get their workers and community members vaccinated. And starting tomorrow, it will be open to all residents in Peel. Next week, Peel Public Health, in partnership with Bruce Power, will launch a massive clinic at the CAA Centre in Brampton, which will be the single largest clinic to date in this province, if not perhaps in all of Canada. The clinic will use the Hockey Hub model that has a flow-through process that allows for more vaccines to be administered with fewer clinical staff than the traditional mass vaccination clinics. The clinic will run for a month, and we hope to administer approximately 250,000 vaccines there. And while this will be an important way for many essential workers to get vaccinated, it will also be open to everyone in Peel. Residents will be able to book a vaccination there through the provincial online booking system, and I will provide more details in the days to come. Mississauga, we have quickly moved ahead on so many fronts. We are well on our way to reaching our goal of 75% of all residents 18 plus with 1 dose of the vaccine by the end of this month. That's right, by the end of May. And to those of you who haven't booked your appointment yet, please do so as soon as possible. You have so many options, whether it's at one of our mass vaccination clinics, at our hospitals, at your doctor's offices or other primary care providers, or at any number of pharmacies right across the region. Getting vaccinated is how you help prevent the spread of the virus, prevent a fourth wave, and reduce the number of hospitalizations. How you can help get us out of this lockdown sooner, and how you can protect yourself, your loved ones, and the entire community. We have the supply right now, and there are plenty of appointments available. The easiest way to book is by visiting peelregion.ca/COVID-19 vaccine. I'd like to thank the provincial government for prioritizing hotspots like Peel over the last several weeks. This has allowed us to get so many people vaccinated and has helped bring down our case counts. The province has really stepped up for Peel Region. And after talking to Dr. Lowe, I'm now asking the province to give us a bit more flexibility when it comes to vaccine allocation. We need to continue being efficient in how we get the vaccine out the door and into arms. And we don't want to be in a situation where either we don't have enough vaccine or we have way too much to get out the door. So I ask the province to continue working with Peel Public Health to get us the right amount of supply at the right time. A system that allows us to ramp up and ramp down based on demand. This will be critical in the coming weeks as we continue to make second doses available to more and more of our residents. I know that there's been a lot of questions about moving up timelines for second doses. Currently, only populations who are at very high risk are exempted from the 16-week dose interval. This includes transplant recipients, those on dialysis, those with certain forms of cancer, First Nations, Inuit, and Métis adults. The province also announced on May 10th that healthcare workers in the highest risk category are eligible to receive their second dose at the shortened interval. Dr. Lowe has told me he understands that the province is actively working on a strategy to get more second doses out to those who are eligible, and we should get more details very soon. We also need more details on what's coming after June 2nd, when the current stay-home lockdown order expires. Yesterday, the health minister said that the province will not be moving back to the color-coded framework that was previously in place. If that's the case, we need clarity as soon as possible on what the reopening framework will look like. As I said last week, this is critical information, particularly for small business owners who have been severely impacted by the extended lockdown. We all understand and accept that it's going to take some more time before we see a full reopening of our economy. But we need real, tangible benchmarks to work towards this, and a clearly defined and articulated plan. This is so important for practical reasons, but it also gives people hope. Hope that our hard work is finally paying off. Whatever the reopening plan is, the first thing that needs to open up is outdoor recreation. We know that the vast majority of our doctors and experts are in agreement that outdoor recreation is safe right now if the proper precautions are taken. The Ontario Medical Association, which represents Ontario's physicians, also made that clear in a statement last week. We need to see movement on this before June 2nd. And I'll make the plea again to the province. Please, open up outdoor recreation right now. Let people play cricket and soccer. Let them play golf and tennis, basketball and baseball. Let walking and running groups meet up again, and allow outdoor fitness. The science table says it's safe, so let's follow the science on this. Before I bring up Dr. Lowe, I want to again thank the vast majority of Mississaugans for continuing to follow the advice of public health by limiting their close, in-person contact to just their immediate families. This is playing a big role in driving down case counts and gives us a real shot at seeing some reopenings in the next few weeks. I know a lot of people are eager to return to normal, but we need to continue to bear down over the coming weeks to ensure that we don't see any sudden reversals in our case counts. Our bylaw officers are continuing to respond to quite a few calls about public gatherings, and our policy remains engage, explain, encourage, and as a last resort, enforce. And to support our bylaw officers going forward, Peel Regional Police will now be providing dedicated resources to respond to public gatherings that pose a direct threat to public health. I do want to assure you that both City Bylaw officers and Peel Regional Police will not be doing any random spot checks in parks, playgrounds, or on trails, and they will not be stopping vehicles. Our bylaw officers respond to complaints from community members which come through various channels, including primarily 311, and this will remain the same under this new initiative. So Mississauga, please go out and get vaccinated. You have so many options. Please continue to listen to the advice of public health. I know how tempting it is to set aside the rules right now, especially with the nicer weather and the long weekend ahead, but please, I'm asking, do the right thing. Please, stay healthy and stay safe. And now I'd like to invite Dr. Lowe up to provide his update. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. Mississauga's weekly incidence rate for COVID-19 currently sits at 170.9 per 100,000, with test positivity of 10.8%. We are noting a decreasing trend. However, even with this decreasing trend, transmission levels in Mississauga and the region of Peel remain high. Admissions also remain steady at our hospitals, though they are beginning to stabilize with our decreasing cases. Thanks to the province's stay-at-home order and the additional measures taken around workplaces in our community, we have decreased contact and interactions, and these are driving our improving trends. We closed, and in terms of our action plan of close, vaccinate, and exit, we are starting to see our sacrifices bear fruit again. The grim images seen elsewhere in the world have again been held at bay here in Mississauga and in Peel. We certainly do feel for all that have been impacted by COVID-19 in our community, and we also feel for the communities worldwide that have seen such tremendous misfortune. It's a reminder to all of us that we need to take care of each other and ensure that we also avert a similar fate. So we closed, and now we move to the vaccinate portion of the close, vaccinate, and exit game plan. As our case counts come down and our hospital picture starts to stabilize, things are different. We are now firmly in the vaccinate phase of our efforts. Our vaccinations continue apace, but we cannot let up. And today I want to be absolutely clear. Now is the time to get your shot. Earlier today, we announced increased eligibility in line with Ministry direction on hotspot eligibility and Health Canada guidance on the administration of Pfizer vaccine. Anyone who is 12 years or older on the day of vaccination can now book for a vaccine in our Region of Peel clinics. Please visit peelregion.ca/COVID-19 vaccine for further information and to book an appointment now. I encourage you to also tell your friends and family to do so and talk about your own vaccination journey if you are already vaccinated or planning to do so. For first doses, we are now at 60% coverage of our adult population over 18 in the region of Peel and are projected to reach 75% of our adult population within the next week and a half. That also includes 75% first dose coverage of our 60-plus population and nearly 50% coverage of our population aged 18 to 49. The sooner we get to 75% first dose coverage overall, the sooner we will start to see severity and mortality drop off, allowing us then to move on to second doses. Remember that the first dose is to prevent severity and death. Second doses are to help limit your risk of infection and transmission and seal the deal towards bringing us closer to normal. So I want to thank everyone in our community who has already gotten their first dose, especially those who came out and made Doses After Dark this past weekend such a special event. Thanks to everyone who got their first dose so far for being part of the solution, and I please urge you to stand by for further information on second doses. Remember that the approved products that we are using in Canada are not a one-and-done deal. You need both doses. On the topic of Doses After Dark, this was a tremendous event that I think represented a turning point in our community's vaccination campaign. In speaking with those who I had the privilege of meeting at the event, I learned how that vaccination marathon helped us reach some of those most at risk in our community by reducing barriers to access. We are now on a race to our 75% first dose coverage, and once we get there, we will move quickly to second doses in priority. But while we are vaccinating, we cannot let up on our collective efforts. Other places in the world may be opening, but they are further ahead of us on the close, vaccinate, and exit cascade. We aren't quite there yet. And especially with the long weekend around the corner, I urge all of our residents, stay apart this long weekend so that we can reunite with confidence on the other long weekends that are ahead this summer. Continue to limit contacts. Distance, mask, prefer the outdoors, only meet if you absolutely have to. Don't meet if you get sick, get tested and stay home, and get your shots. Get both of them eventually, but start with your first as soon as possible. Together, we will continue to immunize and bring down levels of cases, moving towards the last phase of the close, vaccinate, and exit triad. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. We've come an incredibly long way in the last few weeks, not only right here in Mississauga, but right across the province. It was only a few weeks ago that we were seeing record case counts in Ontario, and I was up here pleading for more vaccines for Mississauga and all of Peel region. So as to provide us with a bit of a 30,000-foot view, if you will, of where we've been, where we are now, and where we need to go, I'd like to turn it over to our special guest today, Dr. Andrew Buzari, the Executive Director of Social Medicine at the University Health Network. Dr. Buzari, over to you.
Thanks so much, Mayor Crombie. Just want to make sure that people can hear me, but really appreciate the invitation. And really, I think, again, as has been mentioned, about where we've come, and to both Mayor Crombie and Dr. Lowe's remarks about the progress that has been made. And it is something that has been remarkable, but it's also, I think, important to take this time to remind ourselves of the pandemic and how its pre-existing conditions have been chronic neglect and systemic discrimination. And we saw this play out throughout the data in all three waves of where we've seen communities of color and low-income neighborhoods bearing the brunt of the pandemic. And what we've seen, especially in the last 2 weeks, has been incredible in the community leadership, the leadership from local, provincial governments, all levels of government, public health leadership that has been evidenced here, and being able to turn this around and to provide life-saving measures has been something not only to watch, but something that I've been very privileged to be able to work on the ground with communities in various parts of the city. But when you look at the data as to how this all started out, it was very clear that neighborhoods that had some of the top 10 rates in COVID cases were actually in the bottom 10 when it came to access to the vaccine. And what we've seen with the province's reallocation and the prioritization of hotspots, including Peel, is a dramatic reversal in where we've seen neighborhoods that, again, have suffered from chronic neglect, from higher rates of COVID and other structural determinants of health, behind community leadership, have been able to see tremendous increases. And I think when you look at the amazing success of what's happened with Peel After Dark, what's happened in Thorncliffe Park, the northwest of the city with the Black Creek Community Health Center, this is all giving us a lot of hope as to where we need to move, where we need to continue the focus. And I think, as Dr. Lowe has mentioned, that collective focus. And this success, has really been led by community, by you, by people committing to the public health measures, but getting out there to get vaccinated, and the community ambassadors and community leadership to ensure that this vaccine effort continues to move at the speed of trust. And it is really remarkable to see how this has played out over the last 2 weeks. And really, I think from a health and social policy perspective, we're really hoping that over the next stretch, that we are in this home stretch, as Dr. Lowe and Mayor Crombie have mentioned, that we can see a brighter summer, a brighter future, as long as people are following the best public health advice and being able to stick to the measures, that we can get there. But we can't see any slippage when it comes to the focus and prioritization of our hardest hit neighborhoods. We know that outbreaks continue to happen in workplaces. Essential workers have really faced challenges and have been faced with impossible decisions throughout this pandemic. And so it's been great to see more and more supports, but these efforts and these local efforts that are getting vaccines out to workplaces, but also making them available through the night, through shifts. And again, I think as we're allowed to ensure that there's more and more supply that's dedicated to getting out to hotspot neighborhoods and engaging primary care and other community partners and the social supports, the hope is, we've never really seen a horizon like this close. And again, this has been because of collective efforts. And again, it has been something to watch. It has been something of a privilege to be a part of, and to continue to learn from the leadership on the ground in seeing the response take place, but also given all of the, really nothing less than heartache and tragedies play out, the fact that we are getting closer to more and more protection really is something giving us, for all of us on the front line, giving us a lot of promise. And so it's with a lot of gratitude to everyone who's been doing the right thing, who's been doing everything to take care of their neighbors and their community members. And as we continue to see that vaccine supply get out to people who need it most, we all remain very hopeful. And so again, thank you for the opportunity to speak to some of the policy pieces and continue to be encouraged by this data that has been really seeing health equity in motion.
Well, I'd like to thank Dr. Andrew Bozzari. It was such a pleasure to hear your thoughts, and thank you once again for joining us today. And now we are all here available to take any questions from the media.
Your first question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome, Steve.
Hey, Crombie, how are you?
I'm very well. How about you?
Not too bad. I just wanted to ask you about the dedicated resources you mentioned from Peel Police. Can you take me through what the criteria would be where, say, someone phones the city on a gathering? Under what circumstances would the city then call the police? And can you also just kind of address why this was a necessary step?
Yeah, I think that certainly we've seen situations where our bylaw enforcement officers needed the support of Peel Regional Police, and now they've kind of formalized this protocol. So why don't I have Sam Rogers come up and he can walk you through it, because he's walked through it himself with Nish Duriappa, our chief, and over to you, Sam. Thanks.
Thanks very much, Mayor Crombie. Hello, Steve, and thanks very much for the question. So yes, this is really about providing dedicated resources above and beyond what Peel Regional Police have already been providing all the way along. And you may have heard my comments throughout the pandemic thanking Peel Regional Police for their efforts in our joint enforcement So they have always been alongside us. Right now, they're dedicated, though. So when a complaint comes in through 311, they will come to our officers first, and then our officers will assess whether or not police will be required. The reason we had kind of worked with them to provide more dedicated resources was really twofold. One, we've seen complaint volumes continue to increase, and we're expecting that to continue into the long weekend and with the warmer weather, especially around private gatherings. And the second is officer safety. Peel Police are obviously better equipped to deal with large crowds in private gathering situations. We do have concerns about our officer safety, so they've recognized that and have provided some more dedicated. But from the residents, from the public's perspective, there's really no change. We would encourage everybody to report any violations to 311. Our team will assess and then determine whether or not these dedicated Peel Regional Police resources will be required for subsequent investigation and response. Thanks.
Sir.
Thanks. My follow-up question is actually for Dr. Lowe.
Oh, no problem. Dr. Lowe?
Thanks, Madam Mayor. Go ahead, Steve.
Dr. Lowe, just a question about, I noticed there was kind of two sets of consent requirements for the youth vaccine rollout today. So the first one that kind of came out around noon, there was a list of folks that can provide consent kind of on behalf of the youth age 12 to 15. Then a follow-up email from Peel Health said, what has had a much shorter kind of list, and it said basically the 12-year-olds and 12 to 15 can consent on their own. Can you kind of take me through what had changed kind of today around why the kind of the consent protocols had changed?
Steve, it's standard of practice that mature minors who understand the risks and benefits of a procedure are able to consent to it on their own. And in the interests of ensuring that that was made clear, we updated a correction to the initial press release. Thanks for the question.
Next question, please.
Your next question comes from Natasha O'Neill at The Pointer. Go ahead, Natasha.
How are you doing?
I'm very well, Natasha. Thanks for joining us.
Thank you for having me. My first question is about the automated speed enforcement cameras.
Okay.
So this morning, council passed a motion to add 20 new cameras, which has been concluded by staff that will overwhelm the court system. What can you do with council to advocate further to the province to have these changes go through the administrative penalty system instead?
Yeah, so let's just talk about the ASE program for speeding enforcement and how necessary my council feels that it is to reduce speeding and maintain safety and prevent the loss of life in our city. And so we will continue to advocate, and we will write to the province that there be 2 of these cameras in each ward. So right across our city, 2 exist right now. You know that there is a pilot in Malton and 1 in Ward 8 where we did see a tragic loss of life recently. So we will write to the Premier, write to the province to continue to advocate for ASE and ensure that we do everything we can, that they are funneled more efficiently through the court system and through the penalty system.
Awesome.
Thank you.
Yes, my follow-up is about a different situation.
Sure.
I don't know if you can answer this,
Okay.
but it goes out to everyone. Can someone please confirm if the city or Peel Regional Police are pressing charges on the organizers of the protest yesterday?
I believe that they are. Why don't I ask Sam to come forward and tell us what he knows about with respect to, I just wanted to clarify as well with respect to the rally last night. You know, we don't condone the actions. People do have a right to protest peacefully, and it was a peaceful protest. And I also want to clarify that there is no permit required. No one at City Hall issued a permit to allow this gathering to go forward, and that is the case. It's a public facility and people can gather. We don't encourage them to do that, obviously, because we feel that it's against the stay-home lockdown order, and I believe that Peel Police will be pressing charges with the organizers, as they have done in other situations with other large gatherings and rallies and protests. So, Sam, I'll ask you to come forward.
Thanks very much, Mayor Crombie. Not a lot to add, other than to confirm that city staff, so that's my team in security services, have not laid any charges. With respect to Peel Police, I can tell you that typically they, will investigate once the event is over and then subsequently lay charges. But that would certainly be a matter for them to confirm, and I can't confirm the status of their investigation or whether or not charges are pending or not.
Thank you, Natasha. Is there a follow-up? Or that was the follow-up, I guess. Next question.
Yes. Your next question comes from Pooja Luthra at Y Media. Go ahead, Pooja.
Hi, Mayor. How are you?
Thank
you so much for taking my question.
Thank you for coming. Thank you for joining us today.
Thank you so much. Mayor, I would like to know that, Trillium Hospital and Kothari family have raised funds for vital equipment and supplies to support India during these crises. So I would like to know, what city is planning, what role is city playing in this?
So the city does not have a direct role in that. I will share with you that I participated in a fundraising event on Sunday with the Indo-Canadian Chamber of Commerce, and they had a fundraiser, Oxygen for India, in which we were encouraging everyone to donate generously. Of course, India stepped up and helped Canada when we were in need of vaccine, 1.2 million doses of AstraZeneca, and now it is our turn to reciprocate for much-needed ventilators and funds so that their residents who badly need ventilators, oxygen, can receive them.
Follow up?
Yeah, thank you so much. Also, I would like to know that, today Solicitor General Sylvia, she pointed out that province may adapt a sector-by-sector a strategy instead of regional approach.
Right.
So, what do you have to say on this? And, what are you expecting that, province might do this in coming weeks?
Yes.
After stay-at-home order.
Yeah, so we're waiting for details and more clarity on what the plan will be after June 2nd. That's the one thing I asked for today is a plan. We need to know, we need to prepare. It's only the right thing to do, and it gives everyone a lot of hope. And of course, our small businesses need to ramp up. They need to scale up. They need to order product. They need to recall staff. So there's a lot of work to be done. So sector by sector, I assume they'll look at whether it be the retail sector, whether there'll be capacity limits, whether there will be the hospitality, restaurant, hotel sector, and what will involve. I think it will be a long time before we see in-person dining again, but certainly accommodations could be made for outdoor dining, etc. I know that the fitness industry, gyms, etc., have been waiting patiently. They're very hopeful that very soon there'll be an announcement on outdoor fitness. I know that personal care providers have been closed down for much of the lockdown since last November and previously. So those are the types of sectors that are very eager to hear the news as to what their fate will be, when they'll be able to reopen safely. And just looking at Dr. Lowe, is there anything you'd like to add about sector reopening? He's shaking his head. And of course, we're talking about non-essential businesses, because all the essential businesses are been fully functioning throughout the lockdown and the stay-home order.
Your final question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Welcome, Ashley.
So today at council there was talk about stepping up enforcement during the long weekend, and I know some councillors said that they were mentioning parks, and they're worried about having excess crowding in parks. But knowing what we know about outdoors being relatively safe, I'm wondering if over the course of the long weekend is there a plan to have police or bylaw officers focusing on parks and other outdoor spaces, or just kind of responding still to complaints on a complaint by complaint basis?
Thanks for the question, Ashley. I will ask Sam to come up as well. But as you know, we do have a park ambassador program. So we do have individuals who have been redeployed from some of our rec facilities, cultural facilities that were laid off and redeployed out into the parks as ambassadors, and warning people that perhaps they've gathered in too large numbers or are playing sports that aren't permitted right now during the lockdown order. So certainly we'll step up the ambassador program. As you know, our bylaw enforcement and Peel Police only respond to complaints on 311, and I'll ask Sam to come up and speak to any proactive enforcement that will occur this long weekend. Thank you for the question. Sam, over to you.
Thanks, Mayor Crombie, and hello, Ashley. Just to echo what Mayor Crombie had to say, education is the main effort and focus within our city parks, and that is led by our parks ambassadors as well as security services. We have educated tens of thousands of residents who have been playing sports and outdoor activities with no tickets or charges. The rare exception is when, you know, it's egregious, it's organized, it's large, it's a large gathering of an organized nature, and there's no compliance. So we will not be conducting any type of proactive enforcement efforts. My team, Peel Regional Police, will strictly be complaints. We'll be focusing as a priority on private gatherings, you know, mostly residential, and leave the education piece to our great parks ambassadors as well as our security services team. Back over to you, Mayor.
Follow up?
Thank you. And another question that I had, I think this was also touched on very briefly at council today, is even though the vaccine rollout has made substantial progress, especially in Peel, I know that some other jurisdictions, Toronto in particular, recently announced that it's still not going to allow any major events until at least September. Is Mississauga planning to do the same and make a similar announcement in the future, that there won't be any large or mass events involving several people or multiple people until at least the fall? Is this an announcement that the city plans to make anytime soon?
Right. So as you mentioned, we had discussed it at council today, and I don't think we feel that we are ready at this point to be opening up Celebration Square to any large gatherings, and we don't foresee that for the, not for the foreseeable future. We have given the heads up to event organizers because, of course, they need time to plan and to prepare and sometimes make financial commitments with respect to the events or the festivals that they want to hold. And so there's too much uncertainty, too many unknowns at this point. So, you know, we've let them know that given the state today, they should probably not planning on hosting their events in the fall. But, you know, if things improve and we start allowing small gatherings, we could have different types of events, perhaps. I'm now blue skying here, Ashley, because I can see occasions where we might allow smaller groups if it's permitted. But right now, there won't be a large gatherings permitted up through the fall, yes.
That's the final question
Thank you.
for the day. Thank everyone for joining.